Is a concierge doctor worth the money? Practically everyone has been stuck waiting for a doctor. Maybe it's the time when you're coming down with some illness, yet they can't see you for a week and a half. Perhaps it's a visit for a condition that's been bothering you for some time, and when you finally get in to see the doctor, you're stuck in the waiting room for 45 minutes, and then you only get 5 minutes of face-to-face time with the doctor. And if you're as frustrated by these kinds of healthcare interactions as most people are, you've probably considered solutions like concierge medicine. This is an area that I get a number of questions about. Specifically, is having a concierge doctor worth the money? My name is Grace Gosnell with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about healthcare and benefits that can make your life better. When it comes to what people think concierge medicine means, there's really two categories that I want to point out. There are concierge doctors, and then there are what are called direct primary care doctors. And while they might seem very similar on the surface, they're actually quite different. We'll get into some specifics on both, but I'll drop a little spoiler up front and say that I think one is absolutely worth the money, and that the other is a bit of a waste. And stick around till the end and I'll share exactly how much I pay. So with all that, let's start talking about concierge doctors. In an arrangement like this, you will pay either a monthly or an annual retainer to gain better access to your doctor, in some cases, even after hours or on weekends. And you can imagine, when you have better access and more time with your physician, you're going to develop a greater level of trust and rapport in that relationship. This will lead to better health outcomes and appropriate ongoing treatment for chronic health conditions. Now back to the retainer you'll pay. These amounts are often reflective of that concierge idea of service. I've heard of practices charging up to $750 a month, and in exchange for that, the patient gets priority scheduling, 4 house calls a year, a monthly primary care visit, and a handful of preventative care services, such as an annual physical, a flu shot, and a wellness panel, none of which costs very much to begin with. So at a value of about $9,000 per year, I have to say that I don't think that concierge medicine is worth it at this price. In addition to that, many concierge practices still bill your insurance company for the value of the services they provide. Now, before we get into the second half and talk about direct primary care doctors, I want to thank Scoop Health for sponsoring this video. Scoop Health is a strong advocate for medical cost-sharing memberships, which pair amazingly well with our next topic. In fact, I've personally been using this combination of medical cost-sharing and direct primary care for many years. I'd love to share more with you about how it's worked for me. I'll leave a link in the description, so please get in touch anytime and we can talk. Now, let's dive into our second half of this topic, and that's direct primary care. Similar to concierge medicine, direct primary care practices charge a monthly membership fee. In exchange for that monthly fee, members get unlimited access to their personal physician and healthcare team, usually with same or next day appointments, as well as online virtual visits. Now here's where they differ quite a bit from concierge medicine. Where concierge doctors might bill insurance for additional tests, procedures, and services, direct primary care practices include a vast array of services in their membership at no additional cost. And when there are things that they may need to bill for, say x-rays, a biopsy, or unusual blood work, they pass on their discounted pricing to their patients. If you're saying to yourself, direct primary care sounds a lot like concierge medicine, but goes a bit further in what it provides with the membership, you'd be correct. So the next question is, what is that going to run you each month in order to have a membership like that? I can tell you that every practice is a little different in what all they include and how they structure their pricing. Generally speaking, pricing will go up with age and adding family members. But to put a bit of a marker in the sand, I'm signed up with my direct primary care doctor as an individual member in my 30s, and I pay about $60 per month for everything I mentioned above. When it comes to all of the primary and preventative care, in-office procedures, screenings, and more that are included, I think direct primary care can be an incredible value and something that more people should consider when it comes to their health. I hope this dive into concierge medicine and direct primary care was helpful for you to understand some of the differences between the two that make one more valuable than the other. If you're interested in finding a direct primary care practice near you, I have a great tool that I would be happy to use with you that looks at which ones are in your area, their pricing, and more. I'll leave a link in the description below where you can find me. On the Health Benefits Network, we have a lot of videos pointing out the many problems with traditional health insurance and new and innovative solutions such as direct primary care. And lastly, please leave any questions and thoughts you have about concierge medicine in the comment section below. To make sure you enjoy more videos like this, please subscribe to the channel and click on the notification bell, as we'll be bringing you more healthcare benefits news and stories. And don't forget to hit the like button and share this video with your family and friends.